Why me? Why me is a common question which people ask to healthcare professionals, especially if diagnosis of a serious disease, advanced disease, near-death disease is made. And people find it very difficult to deal with this question. It's a very emotionally charged question when asked. Health professionals commonly try to give a very scientific perspective of it. They like to give statistics, they like to give risk factors, and they like to combine a combination of risk factors and genetics and environment, and then say, well, why me means you have this disease because of this. Now, this does not satisfy most of the people because they know there are people who have risk factors but they don't have the disease. People who have been exposed to certain harmful factors, but not everybody develops the disease. They might have genetic factors, but not everybody discusses the disease. So they question back again, why me? So how do you deal with this question? Now, this is a very difficult question. And the bottom line is, of course, we don't know really what is the reason why a person has a disease. Now, let's talk about this. So, before answering the question, we tell the person that I would like to answer this question, but before that, I want to check with you about certain things. So, how long have you been having this question, why me? When this question comes to your mind, what answers come to your mind? And this is to check whether they are having any self-blame, sin, guilt, or any misconceptions, misperceptions, myths about why they got the disease. If it is any of those things, we can correct it. But if there are things which are right, then we can say, yeah, maybe this might be partly responsible for your disease. So it's also to check how do they feel about themselves and their disease and their life when they keep asking, why me? So why me will come at many times. Why me will come when a diagnosis is made. Why me will come when medication is given or a surgery is done and it is not effective. Why me will come if there is a recurrence or a relapse. Why me will come if there is advanced disease. Why me will come if there is pain. Why me will come at a number of times. It's not only at the time of diagnosis, but at a number of times. So we consider why me more as a spiritual question, because it allows you to probe into the person's mind about how do they feel and how are they looking at the whole perspective of life. So why me is a very good question to be asked, and do not try to avoid it. But on the other hand, it's a question you don't necessarily have to answer because you don't know. But it's a question which will allow the person to ventilate, speak out their mind, speak out their fears and concerns and various other things that they have. So, and some people say in response to why me, you should ask why not me? Or that when somebody has a success, nobody asks why me. But let's not get into that. That will probably block your communication and conversation with the patient. But when the question why me comes, let them talk about their feelings, fears, perspectives of life, and view it as a spiritual question. Why me?